Okay, okay, we'll start directly. Today we are honored to invite actually the experts from Sichuan province. They are on, they will give you most authentic the most authentic lecture on Zhujiang therapy. Zhujiang therapy is actually a national intelligence cultural heritage. So this is actually our motto. That's all the efforts. Professor Zhong Lei, Professor Jiang Li, Professor Hou, and Mr. Yan, all these are the actors in the field. This is very unique in China. It is still in the last year in May because of the TV event downstairs. Really comes from over there, and then we are honored to invite the video most authentic. Quickly, Professor Zhong Lei is a chief physician and professor, and he's a national recognized curator of the Zhonglü Zhuzhou therapy. He served as the head of Sichuan Zhuzhou Lineage Heritage Studio under the National Administration of Traditional Chinese Medicine, and is representative inheritor for both national and provincial intangible cultural heritage projects in Zhuzhou therapy. He is also the chair of the Zhuzhou Specialty Committee of the Sichuan Association of Traditional Chinese Medicine, and leads several academic and clinical research centers in Sichuan with extensive expertise in traditional Chinese medicine, rehabilitation, and orthopedic acupuncture. has made a significant contribution to the preservation, innovation, and international promotion of 处真 therapy. Please welcome Professor Zhong. 我还会还有个问题，张老师，您可以讲几句，谢谢。
呃，尊敬的胡教授，你好。各位喜欢传统中医的同学们好。
All the classmates.
今天呢，非常的高兴来和大家做关于中国传统外治疗法处针的一个交流。
Today I'm delighted to have the communication with you guys on 处真 therapy.
这个处针疗法呢，是我们传统中医的一个非常特殊的一个外治疗法，它是起源于我们中国传统的道教，它是道士们在练功导引的时候用来治疗和辅助的一个工具和疗法。
处真 therapy is a very special external therapy in China, and it emerged from Taoism. That's when the Taoism, the Taoists, when they practice, they use this external methods to preserve health, to maintain their health.
它到现在呢，已经有了300多年的历史，有了我们18代的传承人。
Until today, we have carried on for more than 300 years with 18 generations.
它的基础理论呢，和我们传统中医的基础理论是一样的，它同样是来源于我们中国最传统的《易经》和《黄帝内经》等经典的这个著作。
The theoretical framework for 处真 therapy is the same as Chinese medicine, which the one you were studying, 黄帝内经 and 易经.
他自己呢有一套他的一个体系，有这个一套工具，3大特殊的穴位，5种手法，所以说他的这个理论是比较完整的。
However, we also have the conceptual theory, conceptual framework, techniques, and 3 groups of acupoints. So although it's originated from 黄帝内经, but it still have its special perspectives.
我们呢现在这个处真的这个团队啊，是做了非常大量的工作，给它做传承和推广，包括它的工具的这个国际的标准化，还有围绕着处真，我们出版了很多很多的著作和发表了很多很多的文章。
To preserve, innovate, and to promote 处真 therapy, the team in Sichuan from Professor Zhong, they actually have done a lot of work on the promotion, standardization, and also academic works to promote the 处真 therapy.
它现在在我们国内啊，有50多个处真疗法的工作站，在我们全国各地基层医院，包括了很多3甲医院，都在广泛的使用。在我们的这个国外，在国际上，比如我们在欧洲啊，在荷兰、在德国、在法国，也成立了处真流派传承的工作站，也有大量的这个外国朋友喜欢处真，而且在学习处真，还在使用处真。
Including hospitals, also the territorial hospitals. Apart from China, in Europe, such as Germany and Netherlands, they also have the inheritance centers. And many people already use the 处真 therapy in their clinical practice.
处真的特点是它是在使用的时候呢，没有创伤，是无创的， 而且它的工具呢是比较简单，它的穴位呢也是很容易去掌握，所以说它是一种无痛的，操作简易的，而且这个经济效益来讲的话，它是比较不是很贵的一种很容易使用和推广的物理疗法。
The characteristic of 主针 therapy is firstly it's non-invasive, so it's actually no pain. As you can see, the needles I gave you is non-invasive, so there's no pain. In terms of the cost, it also effective and cost effective, so it's suitable to use in clinical practice.
所以说呢，我希望通过我们这次交流，让大家了解储针啊，喜欢储针，运用储针，为我们这个传统的中医啊，在非洲大地能够生根结果、开花。
I hope after today's communication, you guys will love 主针. You can promote 主针 and also carry on the heritage on the African continent. I have to add that you are the first group that you study 主针 therapy.
在此呢，我也非常感谢胡子敬教授，在南非能够大力的推广我们中医传统的文化啊，希望在今天的学习过程当中，大家能够学到真东西啊，也祝大家这个学业有成，身体健康。好的，我今天就说这么多。
At last, I will just thank Professor Hu for his efforts in promoting 主针 in Africa. And also, I wish you guys will learn a lot from today's lectures and actually love 主针 therapy. Thank you.
好的，胡教授。
好，谢谢钟教授，
好的，好的，再见哈。
再见哈。蒋主任后面就您讲是吧？您静音了。您在静音，我这边应该没办法帮你开声音，是不是？unmute 可以。诶，
下一位是董老师讲，董老师在线上。
董老师是吧？
董远为董老师。对，
哎，好好，那我介绍一下。
胡教授你好。
哦，董老师，你稍等会，我帮跟介绍一下。Next week
胡教授能听到吗？
可以，您可以切你的那个幻灯片，或者您开一下你摄像头也可以，我们学生见一下您。
嗯。
So next we will invite Professor Dong Yuanwei to the lecture. Dr. Dong is a attending physician in and the 17th generation of representatives of the 主针 therapy. So before Professor Dong introduced the 主针 therapy and 18 generations. Professor Dong is the 17th generation representative of the He also a national He served as the secretary of the Sichuan 主针 Lineage Heritage Area and the Classical Inheritance Center of the Dongyu 主针 Therapy. As an academic reporter of Zonglei Skills Master Studio, he plays an important role in preserving multi-traditional 主针 medicine. Dr. Dong is actively involved in academic leadership, serving as executive member and secretary of 主针 Specialty Committee of the Sichuan Association of Traditional Chinese Medicine, while also contributing to policy rehabilitation, integrated medicine research across several professional organizations. Dr. Dong, over to you. 董老师，您可以开始，您可以直接讲。
谢谢胡教授。我的 PPT 是该怎么那个呢？直接共享屏幕吗？
对。
哦。我点开看一下哈。 看得到我的 PPT 吗？
可以可以。
可以啊，好的，那我就把我的那个，嗯、这样看得到我的 PPT 吧？
可以可以。
啊，
可以哈，
看得到。
好的好的，那我们就开始吧。Uh, Ladies and gentlemen, distinguished colleagues, good morning. It's my great privilege today. I'm Dr. Dong from the Hospital of Chengdu University of Traditional Chinese Medicine. Thank you all for being here. I'm truly delighted to share with you a remarkable trio of Chinese medical heritage, the academy origins and transmission of Li Zhongyu's postolital therapy, a distinguished project list and as national intangible cultural heritage. This ancient hairline art refined through 14 generations of the Li family and over three centuries of clinical practice represents a unique convergence of medical experience, philosophical, philosophical wisdom, and compassionate service. Throughout our session, we shall explore how this gentle yet profoundly effective therapy, employing blown instruments rather than noodles, has brought relief to countless patients, from orig- mm, ordinary citizens to national leaders, and how Master Lee's extraordinary, extraordinary integration of Confucian, Taoist, Buddhist, and medicine learning 11th as a practice to an art form and a way of life. I look forward to engaging with you all and welcome your questions and insights as we journey together through this living tradition. Thank you for your kind attention. First, I will briefly introduce the history of therapy. The therapy, we always call it children's therapy or 立中于 children's therapy or 立中于 therapy. All of them is the same. Um, Originate from Wudang Mount Postolital therapy is a long-standing treatment that has been inherited for over 3,000 years. Postolital therapy is an historic technique for health preservation and guidance in Chinese Taoism. The founder of the Li family in Sichuan, Li Erfei, learned it from a Taoist priest living in the rocks of Wudang Mountain. Known as the true person of religion, for 13 years during his youth. Since Li Erfei It has been passed down through 17 generations. Mr. Li Zhongyu is the 14th generation successor. After practicing medicine, he introduced introduced it to medical use. After more than 60 years of profound research by Mr. Li in the 1970s and 1980s, he gradually made this method public for the benefit of wider public. Now it has developed into a unique and applicable treatment method. Children Pestle therapy, also known as Li Zhongyi children therapy, has become widely known following strong promotion by the National Administration of Traditional Chinese Medicine, the Sichuan Province Administration of Traditional Chinese Medicine, and the Hospital of Chengdu University of Traditional Chinese Medicine. It's convenient to use traditional Chinese medicine technique and combine the benefits of acupuncture point stimulation and massage without breaking the skin. The original and development of the Pestle therapy. Pestle therapy is not mentioned in Chinese medicine classics, nor is it documented in the Taoist canon. During its secret transmission, the method was only orally passed down with no writing records. However, its academic thought originates from the ancient Yi or Fuxi and Huangdi. Its dialectics and legislation, occupation selection, and array formation often embody the meaning of the Book of Changes. In full, the laws of nature, chi basic matter or the energy, Shang phenomenon or manifestation, and Shu mathematics, which are all compatible with traditional Chinese medicine therapy. When treating disease with Pestle therapy, no medication is used and the needles do not penetrate the skin or muscle. The tools are simple to manufacture and the selection of acupoints is constant, mainly focusing on the original collated back through and from to move, which rave card and the bar 8 formations. The principle of having guiding is applied and the technique is simple and easy to operate. There is no pain or damage, no concern of cross infection, and it combines the advantage of acupuncture and massage. There is no pain or damage, no concern. It is safe and effective for all ages, including the elderly, weak, women, and children. Clinically, it can it can achieve safety factor result in the treatment and rehabilitation of various acute and chronic disease. Pestle therapy originating from Taoist Yang and Daoyin practice. The ancestor of this family learned the technique of Chu Zhen from Taoist master Ru Huan in Wudang Mountain. From then on, it has passed through 17 generations. Professor Li Zhongyu is the successor of 14th generation. Li Zhongyu has been working as physician over 60 years. In 1970s, he published Chu Zhen. Now it's a unique of and effective therapeutic method. Mr. Li Zhongyu has profound academic attainment and extensive clinical experience, which command admiration from future generations. To benefit more patients in the 1980s, he made public his family's unique children three-part reservation 17th five-year key research project. The therapy's characteristics of being simple, the expensive, convenient, and effective on the factor of many medical workers and patients. In 2005, Li Zhongyu's Pestle therapy was selected as a representative project of Sichuan Province Intangible Cultural Heritage. In 2013, it was approved as a National Academic School inheritance. Still, the Sichuanese School of Children Therapy inheritance still. In 2017, approved by the Sichuan Provincial Administration of Traditional Chinese Medicine as the Li Zhongyu Children Therapy Healthy Center. In the 2018, the Sichuan Traditional Chinese Medicine Society Children's Special Committee was established. In 2021, it was approved as a nation representative project of the intangible cultural heritage. In 2022, the Li Zhongyu Children Classic Inheritance Center was approved by the Sichuan Province or Provincial Administration of Traditional Chinese Medicine. This journey has been the result of the efforts and dedication of generations of practitioners maintain the children tradition, who, by adhering to integrated while innovating and continuously and advancing, have revitalized this traditional Chinese medicine technique, one that was nearly lost to history. So, why is the full name of this therapy Li Zhongyu Pestle therapy? This brings us to the est- esteemed professor himself, whom I must introduce to you properly. Li Zhongyu, a mile from Penzhou City, Sichuan Province, entered, entered a private school at the age of 5 and pursued medicine at the age of 13. He studied under his uncle Li Peishen, a scholar in the late Qing dynasty, and later under Li Guolan and Liu Ruiren, renowned doctor in Tianpeng. The Tianpeng is the Penzhou city. At the age of 17, he started practicing medicine at the county hospital, combined acupuncture and medication. At the age of 19, he obtained the qualification of a registered Chinese medicine practitioner of Sichuan province and entered Sichuan National Medicine College the following years. After the founding of the PRC, he served as director of Penzhou County Health Workers
That's a good point.
and a member of the County People's Committee. In the 19
Genius. Excel.
he was transferred to the Chengdu Traditional Chinese Medicine Continued Education School, and the following year to Chengdu College of Traditional Chinese Medicine, where he engaged in teaching and clinical work in traditional Chinese medicine and acupuncture.
You
In the
Plagiar.
1986, he was
Eric
promoted to chief
migraine.
official and
Migraine.
enjoyed special
Dizziness.
government
Tinnitus. And
orders.
deafness. Puzzling, brain, insomnia, forgetfulness, limb atrophy. Limb atrophy. Limb atrophy. Limb atrophy.
继续哦。
Atrophy. Limb atrophy.
In
喂，宝哥
1996啊，
啊，你下一个讲
喂。
哦。
In 1996, he served as director of acupuncture, finger research laboratory, and the director of the rehabilitation department of the hospital of our university. Member of the Sichuan province political consultative conference, and currently held positions such as exclusion director of the China Acupuncture Society, vice president of the China Medical Qigong Society, and president of the Sichuan Acupuncture Society. Professor Lee was a very expert of the tablet physician, integrating the medicine arts, authoring works such as elucidation of qigong, spiritual school and Pestle therapeutics and philosophy with Master of the Handed School of Thought and the Chinese classic. Religious um, cultivation explained in Huayan and esoteric Buddhist traditions, surviving as vice president of the Chengdu Buddhist Association as a law practitioner, and bearing the honor episode Taoist of many treasures and culture on playing shemate with distinguished history, calligraphy, and passion. He was equally accomplished in literature, intellectual discord, scholarship, and clinical practice. Yet more precious still was his compassionate and dedication to healing the world, pursuing worldly service with the spirit of transcendence, a truly incomparable master physician of his generation. Over many years of clinical acupuncture practice, the Venerable Mr. Li Zhongyu observed that numerous elderly, fairly women and children who should have benefited from acupuncture treatment missed their opportunity due to needle failure. His, he therefore applied his family's ancestral postulatal therapy to clinical practice. This modality employs blunt instruments in place of needles, pushing patients and distress. However, it requires considerable digital strength to achieve their therapeutic effects. Having long practiced traditional Chinese medicine, medical cultivation and Tao in expresses, Master Li possessed profound foundational skills in enabling enabling his force to penetrate directly to the deep levels of the acupuncture. Pestle therapy demonstrate demonstrates demonstrates particularly favorable outcomes for um, disorders of the head and sensory organs such as headache, eye, eye disease, tanning tooth, and deafness. When Mr. Li Zhongyu travel, traveled to Beijing to treat several central government leaders, he frequently employed, employed this therapy with excellent result. The Ministry of Health subsequently approved the establishment of an acupuncture postnatal research unit at the Hospital of Chengdu University of Traditional Chinese Medicine, dedicated to promoting Mr. Li's postnatal therapy. With the care of the Ministry of Health and the strong support of hospital leadership and higher authorities, he personally established the acupuncture legal research unit, undertaking numerous national and professional research projects and in traditional Chinese medicine and carrying out the systematical documentation and clinical the study of Master Li's di- diagnostic and therapeutic experience. In 1986, the national key project of the seventh five-year plan, research on Nizhong legal therapy, was approved. To your family, headline technique passed down through 14 generations of the family, which he selflessly contribute to the public good. Master Li personally demonstrated the techniques and guided the initial research. In 1989, this work was awarded the second prize of Sichuan Provincial Science and Technology Progress. Following the reform and opening up policy, several benches and overseas students from the United States and the UK, France, Germany, Japan, Singapore, Canada, Spain, and Netherlands, and other countries are, as well as from Hong Kong, Macau, and Taiwan, come annually to study under the venerable master. Learning Chinese medicine, acupuncture, therapy, qigong, I Ching theory, and clinical practice. In 1993, at the invitation of the Germany Acupuncture Association, the traveled to Germany to lecture on Chinese medicine, acupuncture, postnatal therapy, and traditional Chinese medicine Taoing exercise, receiving an enthusiastic welcome. Mr. Li Zhongyu pressured medical excellence to with um, meticulous care and a varying delegation. He never sought self-promotion, maintained a humble and respectful demeanor, uh, and hurried to seek truth from facts, reject complaints, and held on secretary's praise. Beyond his demanding clinical and research commitment, commitment, Hayward sat alone through cold night by the dim lamplight, right with origins to summarize his experience, published monographs, and impart knowledge without the slightest haste, reservation. Therefore, the fact that Pestle therapy with heritage spanning over 300 years and been passed down to us for clinical application and the benefit of patients is an achievement to which Professor Lee's contribution and truly indis- indispensable. The formation of academic thought in Pestle therapy. From young Master Lee de- devoted himself to Confucian studies. In his mature years, he delved into Lao Tzu, Zhuangzi, and various schools of the philosophy, ultimately finding his guiding principle in Buddhist teachings. Attain profound realization in Chan historic and Pure Land tradition. In instruction his students, he adapts his teaching to each individual's capacity, thus achieving harmony and national aid. One Confucian philosophy culture. He thoroughly studies for the four books, the Alex Measures, Great Learning, and Doctrine of the Main Mastering, the fundamental tenets of Confucian, its social concepts, and the philosophy of origins of the unity of knowledge and action. His heart embodied the benevolent love of theirs. His person practiced tolerance and generosity. His will expresses difference and forgiveness. He future studied the Book of Documents, Book of Rites, Book of Poetry, and other classic, comprehending the evolution of Confucian learning from Confucius, directing all to Wang Yangming's philosophy and mind nature. He pursued learning for self cultivation, for refinement of practice, and for practical application. dedication himself to the establishment and of virtual meritors and achievement and enduring the distorts. Through this, he developed an integrated conversion personality, practicing the unity of knowledge and action, and the cerebral cultivated the physician science of social responsibility. He thoroughly studies the Tao Te Ching, Yin Fu Jing, and 台商感应篇, embodying the virtues of compassion and fragility, and resolve to become a person of moral integrity. He comprehensively grasps to the philosophic concept of the 庄子, 李子, and 华兰子, and advanced to study the Su Shu and Sun's art of war. Understanding the lives and deeds of Taoist um, practices such as Zhang Sanfeng, Wang Chongyang, and Tao Hongjing. He took Sun Simiao, the true person's son, and his explorer. A, a constitution proved the true mission of the life and vowed to universally relieve the suffering of all sentient beings. Through this, he cultivated a breast of spirit that revered heaven, earth, and the sanctity of life, observed the way of hell, and acted in accordance with heaven's apparition and thereby elevated the critique of physician to a higher plane. Three Buddhist philosophy culture. He thoroughly studied the Heart Sutra, Diamond Sutra, and Mega Sutra, and the Pure Land traditions, 5 Sutra and 1 treatise. Mastering the Buddhist view of life based on the Four Noble Truths and the trivial links of department origination. They cultivate ancient wisdom and aspirate to enlightenment for himself and others. He further studied the Lotus Sutra and Vatamasaka Sutra, Surama Sutra, Marathon Japan, and Sutra apply this Chen Wei Shi No, tracing on the establishment of Confucian only, and Yoga Homing surgery taking the benefit of all scientific as his personal responsibility. He vowed to liberate them from the application of body and mind. Through this, he developed the spirit of community to worldly service with transcendent mind and with the ultimate aim of the awakening to life's true nature. He perfectly integrated to wisdom and qualities of the great physician's sinner dedication, embodying the idea of 大义精神 the sinner devotion of the superhero. Master Lee's medicine path was rooted in the philosophy of the Zhou Yi, the philosophy through the integration of nature and destiny and the unity of body and mind, and expressed in the principle of harmonization with the way and virtue while discerning then what is the right, exhausting principle and fruiting nature, survey, arriving and distinct. Together with the Huang Di Lei Jing and the Sinon Ben Cao Jing, in principle from an administration training medicals and he adhered to the essential principle of the Shanghai tradition, achieving remarkably effectually through simplicity and profundity. Yet, in clinic practice, following the Yi principle of transformation, he assimilate the essence of the true person, science, essential fiber, and the various school of worm disease theory. Attention, pattern, classy, and consummate mastery. Strebe establishing himself as outstanding master. He compared the Zhou Yi, mastered the Nei Jing, Shen Long Ben Cao Jing, and Li Gao Yao Shi. Merizide Wang and Tang Tou Geku. This is a versatile and familiar. And clearly document the fundamental principle that the Chinese constitutes the substance of medicine, while medicine is the application of the changes. Understanding the progressing of human advanced from religion through art to science and technology. He was able to apply the dialectical treatment, principles of life science and skillfully manage common critical condition. This, this is have said. Comprehensive critic treatment, the essential brilliance of Master Lee's medical artistry lie in the integrated application of decoction, acupuncture and moxibustion, medical plasters, Taoing exercise, and various therapeutic um, modalists in enabling them to complement and enhance one another. Survey in elevation the quality of the healing art, believing human life, and pushing the perfect realization of the physician social value. The first one is um, dedications. He mastered the principal method from and medicine of both the cold damage and warm disease school, skillfully employing inter, internal internal decoction and external washes to treat common conditions in internal medicine, pediatrics, and gynecology, external medicine, and the five senses organ. He grasped the essential method of medicine application together with the principle of principle. She emerged the lumber from the Chou enabling him in clinical practice to treat various traditionally difficult and complex conditions. He achieved remarkable innovation in acute and critical cases such as heart failure, rehabilitation, situated arteries, cancer, and blood desert, renal failure, and liver cirrhosis. Filiform Lido. He practiced master the three-person songs, the tennis points of the thousand gold breastpoint, Ma Danyang's 12 healthy start points, and the key points of the eight extradition extraordinary meridians and 12 regular meridians, exciting in the treatment of common disease, oxys, or medical departments. He further mastered the family of flying eight missile and the made no a flow acupuncture's technique, precisely grasping the reinforcing and reducing measures of living, pressing, tracing, and retaining, exciting in the treatment of extraordinary, difficult, and complex conditions across all medical departments. A Pestle he comprehensive master the eight area point 八正穴 and the Reef carried face pathway 合车路, applying the Pestle therapy to treat various common diseases. He verified the principles of the river chariot through clinical practice and based on the Spino River, Spring River Trenton 闸集合车 mastered the principle of array deployment. He employed Pestle needle and fingernail technique to treat extraordinary, difficult, and complex complaint. Wrote Qigong divitation and provide media guide assistance for practitioner and of various cultivation tradition. 然后 he mastered the therapeutic principles of the tonification, reduction, and training the body, skillfully applying moxibustion in clinical practice to treat various common diseases and was able to commonly use moxibustion medicines according to pattern differentiation. He further mastered clinically effective techniques such as the 太医玄习法, excelling in the treatment of actual and crucial conditions, and was able to assist practitioners in protection, devaluation, and guiding the medicine. And the other is the medicine plaster and the Daoyin. Daoyin named Qigong, but now we call it Daoyin. Next way, the academy sort of Mr. Li Zhongyu sought his life. Master Li thoroughly integrate the learning of Confucianism, Buddhism, Taoism, and medicine, steadfastly unfolding the philosophy sort of the unity of body and mind. His academic thought was founded upon compassionate dedication to healing the world, rooted in the fundamental aim of alleviating suffering and bestowing joy, and consummated in skillful means and deliberated insight. He completely integrated and harmonized the four progressive stages of living life: protecting life, cultivating life, and awakening to life's true nature. The essential crux of Master Lee's academic slowly, solely in responsively assisting patients in the enhancement of their life's quality, and purely in aiding patients in the expression of their lives harmonize. As the saying goes, the physician does not know to offer diagnose, yet diagnose when conditions converge. The way is not lightly transm, transm, transmitted, yet is transmitted when the opportunity arises. This represents the infinitely great mechanisms and the great function of turning toward awakening through the enlightenment and of enlightenment through the train of awareness. Pestle therapy, Pestle tools. The Pestle of rooted in the concept of the finger. Hence, it can also be said to be a manifestation and the expression of the finger. It is a choice when the practitioner lacks internal strength and the finger's pressure cannot penetrate to the internal organs. It's also a convenient method of saving and protecting life. Due to this convenience, the tool used in Pestle therapy become very important. During the inheritance process of the Pestle tools, materials such as oxhorn, sandalwood, jade, and silver were used as basic materials. However, when it came to 14th, 14th generation represent, representative inheritor, Mr. Li Zhongyu, copper was chosen as the basic metro and the standard set of 4 Pestle tools was established, laying the foundation for its promotion to society. Pestle therapy is not only deeply embodies the physical and the physical foundation and of human beings, but also possess profound qualities to humanistic compassion. With the same Pestle instrument and the same selected acupoints, Outcomes outcomes may vary, sometimes effective, sometimes not, or with vastly different results. Apart from factors of the doctor-patient cooperation, this depends to a great extent upon the development of the practitioner's metal will and energetic capacity that that is the depends of their cultivation and realization. In this sense, the process of truly mastering and applying the heart-mind method of Pestle therapy is simultaneously and simultaneously a process of accumulation and refining technique, and also a process by which the practitioner explore and pass toward a relatively free and fulfilling life. This is the insight and that Mr. Lee Zhongyu's heart-mind method of personal three-party offers. That's all. Thank you. My English so poor. That's all.
辛苦董老师。
Thanks, Dr. We will have a break of 5 minutes, and the plan for this morning, we will have another 2 lectures. Will be briefer, so Dr. Dong gave us the introduction of the development and also the background and history of the area. Afterwards, there will be Mr. Yan and Dr. Yang going to tell us the current development and also how to standardize to the therapy. In the end, Dr. Yang should be able to give us a very brief theoretical framework of this therapy one. How does it work? In the end, they will demonstrate the needs to treat some of the writers, the net issues. So in the meantime, you also can practice on each other. We will have a 5 minutes break. Then we will come back in 35 minutes. We can do see every just in case some Okay, guys, just to take note, so that we during the secure on the topics afterwards. We will continue the next lecture will be presented by Mr. Yan Jiabao. Mr. Yan Jiabao is a doctoral candidate with strong academic achievement in traditional Chinese medicine and integrated medicine research. He is currently a committee member of the Sichuan Association of Integrated Medicine and has published several high-quality papers all Chinese articles. He has presented keynote speeches at international. His outstanding academic performance has earned him numerous honors, including the Outstanding Graduate Awards, the National Doctoral Student Distinction and Development was in Sichuan Youth Innovation Competition for the health and wellness industry. Yeah, I hand over to you.
Okay, good afternoon, everyone. I'm Yan Jiabao, a doctoral student of Chengdu University of Traditional Chinese Medicine. Today, I will share insights on the application of Chuzhen. Chuzhen is a non-invasive acupoint stimulation instrument employed pressing or scraping methods on the skin surface to stimulate acupoints, meridians, and the skin itself to achieve the purpose of preventing and treating disease. Over time, the theory of children has gradually evolved into a mature traditional Chinese health care technology covering 4 tools, 5 manipulations, and 3 special acupoints. Over the centuries, in order to meet the therapeutic needs of various body parts and to provide different type of stimulation, children instrument has been standardized into 4 tools. First, this is the 七药混元杵. Its head consists of 7 parallel small cylinders, and its tail is round in shape. This is the 五星三台杵. Its head consists of 3 parallel small cylinders, while its tail features 5 cross-shaped cylinders. This is the 金刚杵针. This is the 魁星 pen 杵针. To facilitate the introduction, I will assign numbers to these children for reference moving forward. The operation of children can be interpreted as the 5 manipulations. They are tapping, lifting, opening, rotating, and separating. Next, I will play a video demonstrating these 5 manipulations.
Lifting, opening, rotating, and separating. Tapping is the manipulation of tapping with the head or foot of the Chu-Zhen at the application site. Mostly, the head of the number 3 Chu-Zhen or number 4 Chu-Zhen is used to apply on smaller areas, and the foot of the number 2 Chu-Zhen is used to apply on larger areas. Lifting is the manipulation of pushing upward and retreating downward with the head of the Chu-Zhen on the skin of the application site. This method is preferred to be applied with the head of the number 3 Chu-Zhen, number 4 Chu-Zhen, or number 2 Chu-Zhen. Opening is the manipulation of pressing down and lifting up with the head of the Chu-Zhen on the skin of the application site. This method is preferred to be applied with the head of the number 3 Chu-Zhen or number 4 Chu-Zhen on a smaller area and the head of the number 2 Chu-Zhen on a larger area. Rotating is the manipulation of circular scraping on the skin of the application site with the head or tail of the Chu-Zhen. This method is preferred to be applied over a large area with the rounded tip of the number 1 Chu-Zhen, number 3 Chu-Zhen, or number 4 Chu-Zhen. Separating is the manipulation of pushing and pulling left, right, up, and down on the skin of the application site with the head or tail of the Chu-Zhen. This method is preferred to apply the head of the number 1 Chu-Zhen on a larger area of the acupuncture point.
Chu-Zhen points are selected following the routine methods of acupoint taking, but there are also 3 special acupoints, which are 八针 point, 合车 rows, and 八廓 points. First, 八针 point, the special points of Chu-Zhen with any acupoints as the central place, a certain distance from the outside as the radius to draw a circle. The circle is divided into A equals, forming the outer 八廓, 八针. Then, the distance between the central place and the outer 八针 is divided into 3 equal parts to form the inner, middle, and outer 八针, and the points formed on the inner, middle, and outer 八针 are called the 八针 point. Next, 合车 row are formed by the Ren meridian, the Du meridian, and 3 side lines on the left and right, 7 in total. They are the pathway for qi and blood to run along the Ren and Du meridians, which are divided into the head 合车肉, the waist 合车肉, and back 合车肉, and the chest 合车肉. 八廓 points are formed by points distributed in A directions around the orbit, air root, and nose tip, which are categorized as eye 八廓, air 八廓, and nose 八廓.
Chujin.
Chuzhen has demonstrated exceptional efficacy in managing various pain conditions, particularly cervical spondylosis, frozen shoulder, and low back pain. For a detailed demonstration of Chuzhen manipulations, please watch this video.
Chujin has been proven to be safe and effective in treating multiple systemic diseases. Its advantages include treatment for conditions such as cervical spondylosis, shoulder periarthritis, back and leg pain, knee osteoarthritis, tinnitus, deafness, hypertension, stroke, dysmenorrhea, headache, and vertigo. Let's take a common illness as an example. Cervical spondylosis due to cold damp obstruction. Typically, Baihui Bajing, Fengfu Bajing, and Dajue Bajing are selected, along with the Hercher Road from Naohu to Darjue. If you are suffering from low back and leg pain, the Yaoyangwan Bajing points. The Hercher Road from Mingmen to Changchang section will usually be selected, and Huantiao, Weizhou, and Kunlun points will also be added according to the condition. The technique of Chujin therapy is not complex, but it still requires a certain level of practice to achieve the best therapeutic effect. Operators need to master the correct use of the therapy, including the way of holding, the height, angle, force, and speed of the needle movement, techniques for tonifying and reducing, acquiring the qi during the practice, and the duration of treatment. Additionally, doctors also need to adjust the treatment techniques flexibly based on the patient's physical condition and response.
Okay. The Chuzhen tradition has a history of over 500 years, passed down through 17 generations. My mentor, Professor Fan Xiaohong, is the 16th generation inheritor of the lineage. Under Professor Fan Xiaohong's leadership, our team has successfully promoted Chuzhen therapy worldwide, training thousands of Chuzhen therapists today. That concludes my presentation. Here are some books related to Chuzhen, along with my email address. Finally, I would like to express my sincere gratitude to Professor Hu for giving me this opportunity to share. I warmly welcome all of you to visit Chengdu for further exchange. Thank you.
Thank you, Mr. Yan. 蒋主任，你可以直接继续吗？现在需要这句话。
可以的。
好。As Mr. Yan, actually, I would like to share with you that last year, July, the group 4 students actually went to the hospital to have training for children therapy. And they are, even currently, they are the first 4 in this time. Hopefully, the first 4 on the continent. So this year, we also plan to invite some students to China And before you guys need to tell me like you will have to go. How many devices do you need? It's bigger, it's gonna be the before you can from the state of Nairobi. So afterwards, we will invite the first young lady to present his presentation. Dr. Jiang Lei is attending physician specialized the orthopedics and traditional Chinese medicine rehabilitation. He serves as the executive member of the Traumatology and Orthopedics Specialty Committee of the Chinese Medicine of Sichuan Association of Chinese Medicine. Contributes actively to osteoporosis and the research. He has participated in the multiple national and provincial research projects and has published several academic papers. Dr. Jiang also involved in the international academic exchange, served as a visiting lecturer at the University of Macau. In addition, he's the deputy editor of the digital editorial board, the textbook, Clinical Form and Joint Science, Chinese Medicine and Western Medicine, reflecting his strong commitment to both clinical practice and medical education. First, Jiang, I hand over to you.
Okay, hello, Professor Hu and everyone. I'm Jiang Leiming from the Hospital of Chengdu University of TCM. It's a great honor for me to be here to share the basic academic theory of children therapy with you. I will explain that in these four parts. Now, and let's begin. Children therapy has its academic ideas derived from the ancient Chinese philosophy of Xi Huanggu. Its dialectical, active acupoint selection and arrangement techniques are often influenced by concept of Zhou Yi, the book of changes, Yingfu, reason, qi, symbolism, and numerology. It also incorporates the theoretical foundation of traditional Chinese medicine and the study of meridian to guide the application of unique needle manipulation technique for treating disease. And there are three special acupoints. The first two special acupoints of children therapy, the bottom points and the Bakor points, originates from the Taoist theory of innate Bagua, the Heche road originating from the microcosmic orbit in the Taoist theory. Taking a specific acupoint as the center, a circle is drawn with a certain radius outward, divided into 8 equal parts to form the external circle. The distance from the center to the external circle is further divided into 3 equal parts, forming the internal, middle, and external circles with corresponding acupoints. The term Ba Zhen can be checked back to the chapter 8 formations in the art of war by Sun Tzu, mainly for in battle and arrangement. The 8 formations are one fundamental formation with 8 manifestations, a concept also stated in Li Weigong's question and answer as the 8 formations and integrated. The core idea behind all of this is to act on the human body and thereby regulate the balance of yin and yang within it. The various bottom points do not exist independently. They all have overlapping parts. For example, among the 命门 bottom points, the inner bottom cover 命门 and 悬枢, the middle bottom cover 腰阳关, 三焦枢, 肾枢 and 气海枢, and the outer bottom cover 志海, 志室. Moreover, 悬枢 is also part of the 脊中 bottom points, and 腰阳关 is part of the 腰阳关 bottom points. Therefore, even if only the 命门 bottom points are selected for manipulation, the manipulation range still includes the 脊中 bottom points and 腰阳关 bottom points. These manipulation methods further enhance the synergistic effect between acupoints and therapeutic efficacy, which is referred to as the combined force effect of bottom points. Let us see the bottom, the 百会 bottom location. 百会at the middle point, line 百会 to 印堂 as radius, making circles. Indications, stroke, hemiplegia, aphasia, headache, migraine, dizziness, tinnitus, and deafness, buzzing in brain, insomnia, forgetfulness, limb atrophy, insane, crazy, epilepsy, and other neurological psychiatric syndromes. Technique, you can use the tapping, lifting, and opening, rotating, and separating. And the 丰府 bottom location, the 丰府 as the middle point. As the middle point, line 丰府. And the line 丰府 to beach hairline as radius, making circles. Indications: stroke, aphasia, headache, dizziness, neck pain, tinnitus, and deafness, buzzing in brain, insomnia, forgetfulness, limb atrophy. Waist, stuffed nose, sore throat, mouth pain, and epilepsy, and hysteria, convulsion, hemiplegia, and other syndromes. Technique, you can use the five techniques. And the 大椎 bottom location is the 大椎 as the middle point, 3 寸 as radius, making circles. Indications: stiff and pain neck, and exogenous fever, cough, and malaria, steaming, heat of bone, night sweats, epilepsy, rubella, and shoulder and arm pain syndromes. And you can see you can use the 5 techniques as mentioned above. 神柱 bottom location, 神柱 as the middle point, line 神柱 to 保护 as the radius making circles. Indications exogenous fever of malaria, and steaming heat or burn, not sweat, epilepsy, hysteria, back arthralgia, and convulsions in children, mastitis, and chest pain, vomiting, and upper extremity flaccid paralysis and other syndromes. So you can use the technique also the five techniques. And the 神教八正 the location 神道 as the middle point line 神道 to 神堂 as radius making circle. Indications palpitation 痔痛 thoracic obstruction syndrome, headache, heartache, chestfulness, insomnia, forgetfulness, coughing, wheezing, convulsion in children, mastitis, red lungs, food obstruction, nausea, and branching, and other syndromes. And the technique is the same. The 至阳八正 location from the 至阳 as the 至阳 as the middle point, line from the 至阳 to 德观 as radius, making circles. Indications: liver, gallbladder, spleen, stomach, pancreas, and other organs disease such as chest pain, fullness, vomiting, stomach pain, fullness, jaundice, cough, asthma, malaria, hiccup, acid, regurgitation, diarrhea, and other syndromes. Technique is the same. And the 金锁八正 location, 金锁 as middle point, line 金锁 to 魂门 as radius, making circles. Indication: epilepsy, a stiff spinal, stomach, abdominal fullness, hypochondriac pain, vomiting, branching, hiccups, jaundice, diarrhea, and other liver, gallbladder, spleen, stomach, and other organs syndromes. Technique are the same. And 己中八正 location,密门 as the middle point, line is from the 己周 to 义舍 as radius, making circles. Indications: abnormal pain, diarrhea, seizures, infantile, malnutrition disease, and prolapse and other stomach disease. Technique is the same. 密门八正 location, 密门 as middle point, line from 密门 to 包荒 as radius, making cycle. Indications: abdominal pain, diarrhea, back pain, nocturnal emission, impotence, vaginal discharge, irregular menstruation, dysmenorrhea, amenorrhea, tinnitus, and deafness, edema, enuresis, low limb paralysis, atrophy, paralysis, frequent urination, urine deficient, fibrin, urinary blockage, other syndromes. Techniques are the same. And 腰阳关八正 and location 腰阳关 as middle point line from 腰阳关 to 大长舒 as radius, making circles. Indications are abdominal pain, abdominal fullness, diarrhea, rectal prolapse, constipation, nocturnal emission, impotence, premature premature ejaculation, irregular menstruation, dysmenorrhea, amenorrhea, vaginal discharge, lumbar pain, lower limb weak, stiffness, spasms or numbness. Okay. The technique is the same. 腰枢八正 location 腰枢 as the middle point line from 腰枢 to 日边 as radius making circles. Indication are mostly same as above. The term 八廓 refers a theory mentioned in TCM. Ophthalmology, it first appeared in the comprehensive discussion on the causes and treatment of disease prefers to ophthalmology, written by Chen Yan in the Southern Song Dynasty. Later, Master Bao Guang's collection of dragon and wood in ophthalmology recorded the content of Bao Kuo theory for the first time in the Yuan Dynasty. Wei Yilin included the first illustration of the 8 regions in his work. Effective prescriptions from generations of physicians, and correlated the 八廓 with the 八卦 and the 8 phenomena. They are heaven, earth, mountain, lake, wind, thunder, water, and fire. Professor Li Zhongyu creatively integrated the 八廓 theory into the 主针 therapy theory, and on the basis of the ocular 八廓, he promotes acupoints such as nasal 八廓 and auricular 八廓. His academic thought is rooted in the local acupoint selection method in acupuncture theory, which holds the acupoints within the same qi meridian segment have the same therapeutic effect. The 八正 and 八廓 points both originated from the book of changes, 易经, and traditional Chinese military strategy, embodying the core principle of DCM theory, which is which is the harmonious unity of heaven and humanity. The term Petle Road first appeared in the collection of Lu Zhong's Transmission of Tao. The book states that the channel for circulating genuine qi is called Petle Road. The qi and blood in the human body circulate along the meridians in an endless cycle, rising and descending ceaselessly. Thus, the special acupoint Petle Road was created. Petle Road is composed of the Ren meridian and the Du meridian and 3 collateral lines on each side, totaling 7 lines. It serves as the pathway for qi and blood to circulate along the Ren meridian and Du meridian. According to its location, Petle Road can be divided into 3 parts: the head region, the lumbar dorsal region, and the thoraco-abdominal region. Petle Road runs parallel to Ren meridian to Du meridian. And from to the nature, day and night alternate, endless repeating, and the human body, qi and blood circulate like an endless cycle. And we can see the Petle in-now section location. One line starts from the in town to 17.2 line starts from the inner canthus. 2 lines starts from the pupil 2. Pupil 2 line starts from the outer canthus. Indication: stroke, paralysis, atrophic limbs, cramps, convulsions, headwind, insomnia, forgetfulness, dizziness, epilepsy, mania, eye disease, ear disease, nasal and other facial syndromes. The technique is the same as above. Petle now tree section location consists of 3 lines on each side, plus the line from the Nao Hu to Da tree, and the left and the right line are positioned such that their distance to the inner canthus of the eye, the pupil, and the outer canthus of the eye is equal. Indications: stroke, paralysis, atrophy, weak limbs, cramps, convulsions, headwind, insomnia, eye, nose, mouth, lips and teeth, tongue and throat, all evidence and dizziness, headache, neck stiffness, and forgetfulness. The technique is same. Petle 追至 section. Location from Da Zhui to Zhi Yang include the middle and 3 lines on each side of the spine. Specifically, the first line is half turn lateral to the spine. The second line is 1.5 turn lateral to the spine, which coincides with the first line of bladder meridian of foot Taiyang on the back. The third line is 3 turn lateral to the spine, which coincides with the second line of the bladder meridian of foot Taiyang on the back. Indications: cough, wheezing, cold, warm, evil beginning, malaria, chest pain, heart palpitation, insomnia, forgetfulness, heartburn, and cardiopulmonary disease and dysphonia, vomiting, inverse vomiting, and other spleen and stomach disease. Technique is the same. 合车名扬 section. The locations consist of the middle from 至阳 to 命门 plus 3 lines on each side of the spine along the same path. Specifically, the first line is half turn lateral to the 2 meridian. The second line is 1.5 turn lateral to the spine, and which coincides with the first line of bladder meridian of foot taiyang on the back. The third line is 3 turn lateral to the spine, which coincides with the second line of the bladder meridian of foot taiyang on the back. Indication: epigastric pain, hypochondriac pain, bloating, diarrhea, dysentery, hiccups, vomiting, branching, constipation, frequent urination, urgency, dysuria, hematuria, uresis, irregular menstruation, and dysmenorrhea, urine bleeding, and gynecological disease, emission, impotence, and weak lower limb, paralysis, and other disease. Technique is the same. The 合车鸣墙 section locations the middle from the 命门 to 长墙, and the 3 lines on each side of the spine along the same route are specifically as follows. The first line is half turn lateral to the spine. The second line is 1.5 turn lateral to the spine. This line coincides the first line of the bladder meridian of the foot taiyang on the back. The third line is 3 turn lateral to the spine. This line coincides with the second line of the bladder meridian of foot taiyang on the back. Indication is the same like the 名扬 section. And the 合车天丹 section location includes the midline of the 任 meridian from 天突 to 潭中, as well as 3 lines located half turn, 1.5 turn, and 3 turn lateral to the 任 meridian, respectively. Indication: acute and chronic disease of esophagus, heart, lung, the diaphragm, such as chest B, such as like chest B, palpitation, chest pain, insomnia, mania, cough, wheezing, hiccuping, vomiting, and belching. Technique is the same. And the 合车单阙 section location comprises the median line of 任 meridian from 潭中 to 神阙. along with the 3 lines that are half turn, 1.5 turn and 3 turn lateral to the red meridian respectively. Indication: disease of spleen, stomach, liver, gallbladder, such as epigastric, distension, pain, chest B, hiccup, blanching, vomiting, rib pain, diarrhea, jaundice, and so on. And 合车缺极 section location consists of the median line of red meridian from 神阙 to 中极, as well as 3 lines that are half turn, 1.5 turn, and 3 turn lateral to the red meridian respectively. Indications: disease of large and small intestine, urea, bladder, pelvic cavity, uterus, such as Lindsay John, and diarrhea, abdominal distension, constipation, dysentery, lower abdominal pain, and things like that. The four instruments have been introduced by Dr. Yan. I will not describe them for another time. So let's go to the next part, technique. The 5 techniques when we do the operation, we have to do these 3 things above. First, the mental cultivation. First, be calm and focus when operating, with mercy in the art, and when treating the patient, using the mind to guide qi, then regulate yin and yang. And you can communicate between doctor and patient to instrument selection based on the regions of the human body, based on the region of manipulation area, and based on the different techniques. Third, the position. Position based on the acupoints you select to manipulate to put the patient into supine, lateral, parallel, or sitting. The tapping, when you use the tapping technique, the technique of tapping the areas of treatment with the head of foot of Chu Zhen. Lifting, the technique of the using head of Chu Zhen to push forward and pull back on the thing of treatment area. Operating, the technique of using the head opening, and the technique of using the head of Chu Zhen to press down and lift up on the skin of the treatment area. Rotating, you can use the technique with the head of the head or tail of the Chu Zhen to grip in a circular motion on the skin of the treatment area. Separating, the technique of using the head or tail of Chu Zhen to push and pull left and right, up and down on the skin of the treatment area. And these techniques are shown as above, from Dr. Yan. I will show you the video of how to use this technical. This is separating. Use the head of children. This is lifting. Pull up and pull down. And opening. When to the opening, the head of children does not leave the skin and rotating. Use the tail of the children to do the operating, to do the operation. Precaution. Children's therapy it will not infect the skin. But when you use it, you have to notice these things. Children's therapy is not suitable for the patients who are excessively hungry or fatigued. For women who are more than 3 months pregnant, children application is generally counter indication on abdomen, waist, and scalp region. 3. Children's therapy is contraindicated for infants who fontanelles have not yet closed. Children's therapy is generally not performed on areas of skin with infections, and with ulcerar scar and tumors during children's therapy. Precautions should be taken to avoid skin damage and internal organ contusion. If excessive forcing during Pestle needle manipulation cause local skin ephimosis, pearl or blue discoloration, no special treatment is usually required, as it will resolve on its own. And this is the picture of our hospital. I welcome you to visit China and our hospital. Give the advice to us. Thank you.
你要讲主任，感谢。我们休息10分钟，然后演示。
好的，我把那个就是医生准备好，医生和那个操作者和那个被操作者准备好，然后我们就开始演示给大家，可以吗？
好，可以。大概需要多久？让他们休息一会儿。
10分钟左右应该够了。
好，可以。
好的，谢谢。
You have about 10 minutes break, and afterwards we can do demonstrate. You also can practice on each other. We only have very limited instruments, so if I'm not wrong, we have 10 sets of instruments, but each set we got 4 Pestle needles. So if you don't have the specific one, they demonstrate that you any one, but any different type, to try to practice the techniques. 江主，我们可以稍等一会儿。您静音了那边。我们从20分开始吧，再等个3分钟。
好的，好的，我现在就是在找角度把它录好，大家看得清楚一点。
好好，
嗯，好。
哦呀。
So then an approximation of how much.
这是括号操作上面方面。胡教授，我这边已经准备好了。胡教授，我这边好了啊，帮我
啊，好的，
啊。那个家宝也帮忙那个随时翻译一下。
好的，好的。
好。
Guys, may demo the image outputs. I see that my demonstration in the meantime they will show you what they do.
现在我们进行一个
Similar to the second demonstration on for spondylitis.
第一胸椎、凹陷术啊，凹陷术，第六是转区 ，EX 是颈椎的疾病，然后操作到这个
声音有点小，声音有点小，这样
可以了吗？现在可以开始操作了吗？
声音有点小。
我没说话的嘛。好的，
可以了吧？
胡教授，我们可以开始了吗？
可以。
好的，行。现在我们就来简单的演示一下我们颈椎用杵针怎么治疗。首先呢，我们做颈椎呢，我们要选个穴位，我们就选我们的颈椎的八正穴，颈椎大椎穴位的八正穴。首先我们呢找到大椎穴，大椎穴呢在我们的第7颈椎的棘突和
严博，你这翻译啊，留点时间给我，你要停顿一下我才能，
你不要说太多，说太多翻译不过来。
首先呢，我们要找到这个大椎穴。大椎穴的位置呢，是位于第七颈椎的棘突和第一胸椎的棘突的中间这个凹陷处，这就是我们的大椎穴。
Firstly, you need to locate the body.
然后呢，我们用5星3台杵对这个大椎穴进行一个点扣的手法。
We use the tapping operation to tap on the 大椎 acupoint.
对，然后大椎穴呢，我们做大椎八正呢，我们会把这个大椎穴和旁边的肌肉分成了三个正，一个是我们的内八正，内八正，我们的中八正和我们的外八正。
The inner 八正 outer 八正 middle
内八
八正
正、中八正、外八正。接下来呢，我们就随着我们的八正穴做一个点扣的手法。先沿着我们的内八正做点扣。
Use the tapping technique along the inner 八正。
我们做点扣手法呢，点扣的次数啊，我们都是以7或者7的倍数做一个点扣。
We use the check of 7
沿着内八正
tap on
点7次，点7个圈，就是7次。
Along the inner 八正 you use 7 times.
7次点完之后呢，我们点中八正，也是一样的，一次点7次。
Then we tap on the middle 八正 with 7 times.
然后沿着我们的外八正，整个外八正再点7次。
Then extend the entire 7 times the outer 八正。
接下来呢，我们会用这个金刚杵。
We use the 金刚杵 the 3杵正。
做一个运转，也是一样的。
It's the rotating manipulation.
先沿着我们的内八正做一个运转7次，也是一样的。
Also with 7 times in the inner 八正。
对，我们做运转的时候呢，我们是以顺时针为我们的补法，所以说我们就顺时针的运转，顺时针的转动。
Crosswise rotating.
然后是我们的中八正。
And then there is the middle 八正。
然后是我们的整个外八正。
Then is the outer 八正。
八正穴，然后我们会用我们的
七药混元杵做一
Then
个
we
分
use
离的
the
手法，
七药混元出阵对
对颈椎呢做一个
use
分
the
离手法，
separating manipulation for the vertical.
它沿着我们的
Follow the
沿着我们的肌肉做一个分离，
follow the muscle for the separating.
也是7次。
Also use 7 times.
当 we are operating, we should talk with the patient if the administration is job. You have to be more gentle. 然后操作的过程中，如果有疼痛的话，要随时交流，我们可以减轻它的重量。
And we should ask the patient for the we should ask the patient how feel we can yeah.
7次做完之后呢，我们就会做我们的理法，就是左右这样分推为理哈。
Then it's the left and right separating.
Thank you. 做这个手法的时候，我们把整个肩部都可以概括进去，因为它颈椎背离会引起我们的肩部的一些疼痛。When we are breathing, we could cover the area of shoulder because the cervical disease can lead to the pain of the shoulders. 现在我们用我们的4号杵，就是我们的魁心笔，对我们的大椎穴以及我们的肩颈穴，还有我们的风池穴，做一个我们的开合手法。
And we use the creasing pen tool on the 大椎 point for the opening and closing of manipulation.
对，做一个开合手法。我们找到大椎穴之后，然后轻轻的往下点。
You tap the 大椎 point, acupoint, tap gently.
有3到4秒钟之后，然后再慢慢的往上放，然后这个杵针的针尖是
And
不
for
离开我们的
3
皮
or
肤的。
4 seconds, we
And the head of the children do not leave the skin, and the cervix is the surface of the skin. 然后呢，我们再做风池穴的一个开合，轻轻的下沉，稳3到4秒钟，然后再慢慢的放松。杵针下沉的时候呢，是气血打开。 然后杵针慢慢上升的时候呢，是气血闭合。We use the children to the puncture take point, and when the children are pressed down, the heat and blood will go step. 手针散开往喜欢，聚集。 will come together, and when you lift the 储证the qi and bread 拿起来的时候 and will separate. When lift the qi and bread will separate.
记得是我们的肩颈穴。它点扣的次数呢，也是它开合的次数也是7或者7的倍数。
做完之后，
现在我们做最后一个手法，用我们的金刚杵对我们的大椎、
The last
风
technique
池、
is
肩颈进行一个升降的手法。
the last manipulation is the lifting.
金
We
刚杵
use the 金刚杵
对我们的大
on
椎
the 大椎 acupoint.
进行一个升降的手法。我们轻轻往上推为气血上行，
You're pushing
坚持
upward, and the blood is
坚持
the
3到
qi
4
and
秒，
the blood for
然后回归原位，然后再慢慢往下推进，这是气血下降。
gently push up and then slowly push down.
也是一样的，反复做7次，在一个穴位上。
Repeat 7 times.
下面对我们的肩颈穴做一个我们的升降。
Use the lifting manipulation on the 肩颈 acupoint.
最后对我们的风池穴做一个升降的手
Finally,
法。
let's on the 风池 acupoint. Use the lifting manipulation.
So for certain techniques, you can use from TV21. TV21. But what is demonstrated not on TV20?
整个杵针的颈椎操作过程呢，就是15到20分钟。然后接下来我们的操作就已经
The
结束
entire
了。
manipulation procedure with is 15 to 20 minutes.
对，操作过程中呢，我们要时刻的与患者沟通，避免产生的剧烈的疼痛，针刺过程中的剧烈疼痛。
We need to avoid the severe pain, so we should communicate to the patient.
操作过程中，患者的皮肤有微微发红，就代表他已经得气了，这个杵针的治疗效果已经达到了，就是。
So after your like we redness on the speech. 但是地方的这个地方这个。
胡教授，胡教授，刚才我们杨老师那个演示了储针的一个操作啊，大家有什么想了解的，或者说有什么疑问的？
我问一下，那么讲，我的原本还想说，你我的在往这个
就不想说几句吧，你就说。
主要好像是这个
这魁星饼，
魁星饼，
想让你们再展示一次，就是在大堆那，好像是往上往下的地方。
要说的。
再展示一下吗？
对，就单独这个手法，应该是开合吧，是不是？
哦，开合手法可以在手上演示吗？
对，我们手上演示，
可以在手上演示吗？
可以啊，可以啊。
哎，好的。
我们开合的一个手法，比如说我们取我们的合谷穴，
就这个，
So you can locate that in exercise 4。可以，你可以展示。
Yes。
现在是合谷穴，我们先找到合谷穴，合谷穴在第一掌指关节的中间部位，是吧？这个位置这里有个凹陷处。合谷穴，找到合谷穴之后呢，我们用我们的魁星笔，就是我们的4号储针，做一个开合的手法。开合的手法就是我们先找到穴位，然后把储针慢慢放上去，然后慢慢的下沉。
Last time 4 and now press the needle on top of the stick and press slowly。
慢慢下沉，坚持3到4秒钟。
And keep pressing for 3 to 4 seconds。
然后慢慢的再慢慢的松劲，然后慢慢的让它起来，是不是？我们的针尖是不离开皮肤表面的。
And going to release slowly, so slightly move to superficial. But in the meantime, the needle will never leave the skin of the texture skin.
然后在这个就是刚刚我们教学的基础上面，连续做7次。
You're going to repeat the same techniques for 7 times.
对，它是慢慢的下沉，有酸胀感，就代表它已经点到穴位上，已经得气了。当我们有酸胀感的时候，我们就在这个疼痛的基础上坚持3到4秒钟，然后再慢慢的放松。
So you're going to press until the patient feel the skin pressure, the numbness or the pressure. Once you achieve the skin sensation, you can pressing for
后节，这就是我们的魁星笔的用法。魁星笔的作用呢，它主要是用来刺激穴位，做了一个点穴的作用。
So that the function for this one is to basically stimulate the point. This nice. You can do similar to your acupressure. For example, you can use the needle.
好浓密的鼻涕啊。
可以的，蒋老师，没其他问题。
哦，好的好的，感谢胡老师给那么好的一个机会给我们那个展示和学习。
感谢，非常感谢，辛苦了。然后我们后面到时候微信我再跟您联系。
好的好的啊，
谢谢。
好，
感谢大家。好，拜拜。好，胡老师拜拜。
好，拜拜。
好，bye everyone. Thank you for your time.
不行。